What's a person to do? First, it's the flu, now the norovirus. State health officials have issued a warning saying the virus that's sweeping across the country is now here in Indiana.
It was first identified in Australia last year and has been dubbed the Sydney strain. RTV6 reporter Renee Jamison joins us now with what state health leaders are saying and how you can protect yourself. Renee?
Well, Erica, norovirus infection is not the flu, and flu shots do not protect against it. Symptoms occur within 24 to 48 hours after exposure. It's extremely contagious, and it has arrived in Indiana.
The norovirus, known as the cruise ship virus or winter vomiting bug, is here.
People have not been infected with this strain before because it is new. We are seeing norovirus activity right now, which overlaps with our influenza season.
But health officials warn the norovirus is not the flu. It's a viral infection of the intestinal tract. You can catch it by eating or drinking contaminated food or drink, or by coming in contact with someone who has it.
Norovirus is known as the Ferrari of viruses because of how quickly it spreads through a large group of people. If you get it, it should pass within 3 days.
Norovirus is one of the most infectious things on the planet.
Pediatric infectious disease Dr. Chris Belcher from Peyton Manning Children's Hospital at St. Vincent says norovirus symptoms include abdominal cramps, vomiting, nausea, diarrhea, fever, usually slight, headache, and fatigue.
One of the big problems, especially in younger people or those with medical problems, would be dehydration. And some of the signs of that are just they're not drinking enough or they can't keep it down. Dry, sticky mouths and not a lot of saliva in the mouth, or a big decrease in urine output.
State health officials say in terms of prevention, wash your hands frequently, disinfect high-touch surface areas often, and if you're not feeling well, avoid cooking. Also, if you have it, limit the amount of contact you have with other people.
If they can stay in bed, if they can possibly use a separate bathroom, that can help keep the virus from being transmitted because it is very contagious.
And state health officials tell me they will continue to monitor the situation and will investigate any outbreaks. It's also important to note that the virus can survive on surfaces for up to 72 hours. Diluted bleach of about 10% is one of the best things to use for cleaning up those surfaces. Renee Jamison, RTV6.